After studying this module, you shall be able to know more about how humanist theory is applied to humanistic therapy. Learn its characteristics and important concepts. Identify the different kinds of humanistic therapies. Evaluate of this therapeutic approach critically. Analyze its usefulness in clinical and counseling setting. 2. Introduction. The humanistic model states that every human strives to seek the meaning of his existence and to maximize his personal growth. It is referred to as the third force, after psychoanalysis and behaviorism. This approach views human nature as basically good. They emphasize on positive, more optimistic aspects of human potential for health, creativity and constructive living. According to humanists, if one's environment allows herself to develop freely, then she will become a fully functioning person with a higher vision in his/her life. Humanistic therapists emphasize on forming a therapeutic relationship which is cooperating, trusting, and respect the unique world in which the person lives. It is a holistic approach as it believes interrelatedness between the client's biological, social, psychological and spiritual dimensions. Key proponents of this approach included Abraham Maslow, Carl Rogers and Fritz Perls. According to humanists, each of us should develop values derived from our experiences rather than having that of others, otherwise we may deny our own selves. Psychopathology, according to this view, is essentially the blocking or distortion of personal growth and a natural tendency towards physical and mental health. Such blocking results from an exaggerated use of ego defense mechanisms or unfavorable social conditions or excessive stress. The following image, figure 1, shows the way humanists provide support and acceptance. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. Figure 1, Cycle of Acceptance and Support, as given by humanistic therapists. Source, cyclopedia.wikispaces.com. 3. Characteristics of this therapeutic approach. 3.1 Empathetic understanding. The therapist must enter into and understand the client's own perceptions and subjectively experienced world. He should empathetically try to understand client's frame of reference. 3.2 Uniqueness of each individual. Humanists place emphasis on human potential, which is the ability of individuals to become what they want to and fulfill their capabilities. Moreover, as each person experiences and perceives the world in a special way and participates in his or her own self-creation, each person or client is unique. 3.3 Importance of authenticity. It is important to demonstrate authenticity via genuine, truthful encounter. Exploration of client's problems and assessment and enhancement of his/her motivation must be done authentically and in a collaborative manner. 4. Concept of self-actualization. Self-actualization is one of the most prominent concepts of humanistic theory, which was proposed by Abraham Maslow. Self-actualization is a state of self-fulfillment, which represents the need to fulfill our highest potential. Each person has their own unique way of achieving self-fulfillment, and this state is regarded as the ultimate human motive. See Figure 1, Self. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. Actualization motivates us to perfect ourselves mentally, artistically, emotionally and socially, and to engage in activities for their intrinsic satisfaction and to live deep and meaningful lives, which could be dedicated to the betterment of all people, not just ourselves. Maslow also identified 14 characteristics, called B-values, that he felt define self-actualized people. These values include aliveness, autonomy, beauty, goodness, humor, justice, perfection, simplicity. These values include aliveness, autonomy, beauty, goodness, humor, justice, perfection, simplicity, totality, truth, uniqueness, wholeness, completion and effortlessness. People like Albert Einstein, Abraham Lincoln, Mahatma Gandhi, Mother Teresa, and Martin Luther King, who achieved self-actualization, made enormous contributions to our world. Some of these people achieve a state of self-transcendence, moving beyond a focus on self to commit themselves to the welfare of others, to spiritual fulfillment, and to causes higher than themselves. Colco Rivera, 2006. Figure 2, Qualities of self-actualized individuals. Source. Abraham Maslow proposed that self-actualization even occurs in everyday people. For example, a housewife who gives her maximum to raise and nurture her family, a professor who is able to provide his students with an environment that maximizes their potentials, and a musician who realizes and uses his highest creative potentials, are all can be self-actualized people. Feldman, 2002. Maslow claimed that humans will feel satisfied and comfortable when they use their creative potentials to the fullest level possible. Thus, when humans become self-actualized, they will sense a reduction in the striving for fulfillment and in fact provides a state of satisfaction. Jones and Crandall, 1991. 5. Types of humanistic therapies. 5.1 Rogers Client-centered therapy. Carl Rogers developed the client-centered therapy. It is only a set of principles relating to how the therapy process develops and not a fixed or complete approach. The client-centered approach is called a person-centered theory, as it is a specialized branch of a client and his or her subjective and phenomenal world. The therapist functions as a facilitator of personal growth by helping the client discover his or her own direction. The therapeutic relationship between the therapist and the client is a catalyst for change. The client uses the unique relationship as a means of increasing awareness and discovering latent resources that he or she can use constructively in changing his or her life. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. 5.1.1 View of human nature. The basic behind the person-centered counseling is that people are essentially good. Rogers, 1961. People are generally positive, forward-moving, constructive, realistic and trustworthy. Rogers, 1957. Every human is directed towards self-actualization right from the stage of infancy. Person-centered theorists believe that each person is capable of finding a personal meaning and purpose in life. Dysfunctionality is really a failure to learn and change. Bahart, 1995. According to the phenomenological perspective, it is the individual's view of reality that is important, not the event itself. Rogers, 1955. For Rogers, the word self is the core of his theory. According to him, self is a result of a person's experiences, rather it is an awareness that helps him to distinguish him from other people. Nye, 2000. 5.1.2 Goals. The basic goal of this therapy is to provide a climate conducive to helping the individual become a fully functioning person. For achieving this end, the counselor facilitates the client toward openness to experience. It implies becoming more aware of reality as it exists outside oneself. It also means that one's beliefs are not rigid, one can remain open to further knowledge and growth and can tolerate ambiguity. Rationality. Rationality is a characteristic which cannot be achieved without openness to one's experiences. If a person is aware of his actualizing tendency, then his behavior will be rational in order to maintain and enhance his personal self. Personal responsibility is something which requires a person to feel a sense of responsibility for his or her self-actualization. It covers the Rogers ideas of individuals, which requires the person to believe in his own valuing process, accepting responsibility for his own responses and behavior, and accepting that he is different from the other people. Self-regard, it refers to unconditionally loving and respecting oneself in spite of the fact that we may not like all of our behaviors or traits. 5.1.3 Role of the counselor. The counselor's role is that of the holistic one, in which he enforces the relationship of the counselor-client with emphasis on the I-thou qualities. The counselor constructs a positive climate where the client can explore freely all of the aspects of his own self. The counselor is aware of the verbal and nonverbal language of the client, and she mirrors back what he or she is listening and observing. The counselor's job is to facilitate rather than direct. The therapist makes limited use of psychological tests. One of the tests often used is Q-SWOT technique. Due to this loving, trusting, respecting, accepting and understanding attitude of the counselor-therapist, the rigidness and defensive perceptions between both the client and the therapist gets loose and easy with both of them and moving to a greater level of personality functioning. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. Rogers 1987 emphasized various conditions important for a change. There must be a psychological contact in between the persons. Vulnerability, anxiousness and incongruence are shown up in the client. The therapist is able to integrate himself fully in the relationship. A positive regard which is unconditional should be felt by the therapist for the client. The therapist understands empathetically in a frame of reference of the client and able to communicate this understanding to him. The therapist's empathy, understanding and unconditional positive regard should be communicated to the client at least to a minimal degree. Following figure shows an illustration of therapist's perspective and what kind of perspective is necessary for a therapist to provide good therapy. Figure 3, Therapist's perspective. Source. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. 3 personal characteristics or attitudes of the therapist that form a central part of the therapeutic relationship are as follows. Congruence or genuineness. Congruence or genuineness refers to consistency between the way therapist feels and the way he or she behaves. It is the counselor's readiness for setting aside concerns and personal preoccupations and for being available and open in relationship with the client. Moon, 2007. Congruent therapist is without a false front and is real, that is, the therapist is genuine, integrated and authentic during therapy hour. He or she is without a false front, his or her inner experience and outer expression of that experience match, and he or she can openly experience feelings and attitudes that are present in the relationship with the client. Through the person-to-person relationship, the therapist works toward his or her own becoming and self-actualization as well as toward the client growth. The therapist must take the responsibility for his or her own feelings, and he should try to analyze those feelings of the client, which does not permit or hinders the therapist to be fully present with the client. According to Rogers, congruence can also be viewed via the concept of presence. In counseling, clients and counselors can obtain altered states of consciousness due to which they may have an insight of the evolutionary flow going on inside. Unconditional positive regard. It refers to the belief of the therapist in his client's ability for required changes if given with the appropriate nurturing environment. The therapist shows the client intense and true care and love for the client. The unconditional caring is one which is unaffected by the judgment of the client's feelings, thoughts, and behavior as appropriate or inappropriate. The therapist values and warmly accepts the client. The therapist communicates through his or her behavior that he or she values the client as the client is and teaches the client that he or she is free to have his or her own emotions, thoughts and behaviors without losing the acceptance given by the therapist. Empathy. It refers to viewing the world of the client's subjective experiences through his shoes or skin. Therapist needs to be sensitive to the continuous flow of experiencing that goes on both in client and in themselves. Moreover, the therapist should communicate his own understanding of the subjective and personal world of the client. The aim of empathetic understanding is to encourage the client to get closer to himself or herself, to experience feelings more deeply and intensely, and to recognize and resolve the incongruity that exists within the client. The concept implies the therapist sensing the client's feelings as if they were his or her own without becoming lost in those feelings. All 3 characteristics, attitudes exist on a continuum. It is not an all or none matter. The greater the degree of therapist's congruency, unconditional positive regard, empathy, the greater the chance that the client will move forward in therapy. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. Figure 4, Characteristics of Client-Centered Therapist. All 3 characteristics, attitudes, also demonstrated in Figure 2, exist on a continuum. It is not an all or none matter. The greater the degree of therapist's congruency, unconditional positive regard, empathy, the greater the chance that the client will move forward in therapy. 5.1.4 Techniques of Client-Centered Therapy. There are various techniques that have been proposed for person-centered therapy. Non-directive period 1940-1950. This was the time of development of theory when the primary focus of the therapist was to provide the client with a permissive environment and carefully listen to everything what the client speaks. The counselor did not provide interventions, but showed only acceptance and clarification. Reflective period 1950-1957. At this time, the therapist tried to become non-judgmental about what the client speaks, while clearly reflecting the feelings of the client like a mirror. Experiential period 1957-1980. This period began when Rogers 1957 findings on the important conditions for therapy came into light: empathy, unconditional positive regard and congruence. This period helped the person-centered counseling more active and more well-defined. Since 1980, the person-centered counselors have tried a number of other techniques, such as limited self-disclosure of feelings, thoughts and values. Corey, 1991. Clients' growth through experiencing themselves and others in relationships. Therefore, Rogers believed that significant personality change could not occur except in a relationship. Other techniques include actively hearing to what client says, appropriate mirroring of the client's effect, clarification, summarizing, confronting in general or open-ended way of leading. Poppin and Thompson, 1974. Psychology paper number 15, Clinical Psychology module number 31, Humanistic Therapy. 5.2 Gestalt Therapy. Frederick S. Fritz Perls, 1969, a psychoanalyst of Europe, developed Gestalt therapy. Gestalt therapy involves a way to experience, feel and express rather than to interpret. It focuses on the behavior, thoughts and feelings of the moment rather than the behavior, thoughts and feelings of the past. Understanding that the emotional responses to present events are faulty, a residue of habits acquired due to suppressed conflicting thoughts. Lavendula, 1963. In German, the term Gestalt means principles of perception via which we arrange elements of the stimuli to meaningful, whole patterns. Gestalt therapy has a focus on the body-mind unity, emphasizing the need to integrate own thinking, affect, and behavior. Generally, while perceiving, for instance, external stimuli, ideas, or emotions, we focus on only the part of the experience that is, the figure, while ignoring the background which lies behind the figure. For people with psychological difficulties, the ignored background includes important feelings, wishes and thoughts which are blocked from awareness because they might evoke anxiety. Gestalt therapy's goal is to teach clients to recognize the bodily processes and emotions they had been blocking off from awareness so that the client can be whole once again. Thus, to increase the individual's self-awareness and self-acceptance, by helping clients become aware of the feelings and needs they have disowned, to recognize them that these are genuine part of themselves. Gestalt therapy, even if used for a group, has its focus on a person at a time, trying to help them identify the characteristics of the individual self or the world that are not being acknowledged. Following figure provides a cycle in which Gestalt therapy proceeds. Figure 5, Gestalt cycle. 5.2.1 Notions of Gestalt therapy. Psychology paper number 15, Clinical Psychology module number 31, Humanistic therapy. Wholeness and integration. Wholeness can be defined as the unity of mind and body, instead viewing them as of distinct parts. Seligman, 2006. Integration can be defined as to how an individual's parts fits with each other and how he unites them into the environment. Awareness. Awareness is a sign of good health in a person and is itself an aim of the treatment. Seligman, 2006. An aware person can regulate his environment effectively. Energy and blocks to energy. A major emphasis of Gestalt therapy is on where the energy resides in the body, way the person uses it, and the way it may cause a hindrance. Corey, 2005. Growth disorders. Growth disorders can be defined as the problems which are emotional and are due to incomplete awareness or incomplete interaction with one's environment. It is due to the growth disorders that some people find it difficult to perfectly deal with the everyday hassles of their life, so they then may resort to self-defense mechanisms. Seligman, 2006. Unfinished business. Unfinished business is often related to the people having a growth disorder. Such people often find it difficult to finish their works on time. Seligman, 2006. 5.2.2 Goals of Gestalt therapy. Therapists' aim is not change clients but to improve their self-awareness of the present moment. Another goal is to develop awareness of their own realities and to help them take responsibility for choosing their present situation. A major focus of Gestalt therapy is on the I-thou relationship, in which a high emphasis being given to the present moment and leads to the future or past. Seligman, 2006. Therapist needs to understand the experiences of the client, which involves consideration of client's verbal and nonverbal behavior. 5.2.3 Principles behind techniques of Gestalt therapy. Enactment is a method where the client is asked to transform his feeling or thinking into a behavior. Exaggeration is a special kind of enactment in which the individual is being asked to express his feeling, thought, movement, etc., in a greater amount than it is, so to experience it more intensely. Psychology paper number 15, Clinical Psychology module number 31, Humanistic therapy. Guided fantasy is suggested by the therapist to bring an experience into the here and now more efficiently by visualizing than by enacting. Loosening techniques can assist the client who is so firmly held by the common ways of thinking that alternative ways of thinking are not allowed into the consciousness. Integrating techniques are the techniques of integration in which those processes are brought together from which the client generally maintains a distance, such as by asking the client to locate feeling in the body part. Techniques of body awareness bring clients awareness to the functions of his body, like by asking them to take deep breaths. 5.2.4 Techniques. Gestalt therapy utilizes a variety of methods of imagination to persuade clients to have an insight of their inner selves. These methods are active, dramatic, and sometimes confrontational. The method of experiments or learning experiences of clients is used in the Gestalt therapy. Such experiments persuade the client for transformation of his affect or thoughts to behavior, role play, or other activities that seeks to enhance the self-awareness of the person. Seligman, 2006. Role-playing is one of the techniques used, in which therapists often ask the clients to role-play different aspects of themselves to make them directly experience their inner dynamics. Gestalt therapists believe that by re-experiencing old hurts, jealousies, fears and resentments, therapy goals could be achieved. Empty chair technique is often used, in which the client imagines an important person from his or her past, a parent, child, spouse, is sitting on the chair, and then carry on a conversation in which he alternately role-plays the imagined person from past and himself, changing chairs for each role and honestly telling to the imagined person how he feels about important issues in their relationship. As a result, clients gain insight into their true feelings. This may actually help to reduce the emotional turmoil that brought clients to therapy in the first place, an important benefit in itself. Greenberg, Elliot, Leiter, 1994. Also, the powerful feelings evoked can help clients to become aware of unresolved issues that affect other relationships in their life as well. Recent research on the empty chair technique that it does indeed help clients resolve unfinished business with significant individuals in their past. Greenberg and Malcolm, 2002. In Pearl's approach to therapy, attention is also paid to dreams. According to Gestalt therapy, every dream, no matter how vague or undirected it is, points to an unappreciated characteristic of the person client. The client is asked to avoid any assessment, and to be the object in his dream, and then to report his experience. Top dog, underdog. The top dog underdog dialogue is a type of method of Gestalt therapy in which the two competing views, thoughts or feelings of the client are being tried to be differentiated by the client, after being asked by the therapist to do so. Then the client tries to play the role of each one of these in a dialogue between them. Patterson, 1986. Psychology paper number 15, Clinical Psychology module number 31, Humanistic therapy. Fantasy, the type of technique used by the Gestalt therapist to confront his innermost thoughts and feelings and to bring him close to finish an unfinished business. Seligman, 2006. Guided imagery is used by therapists for creating fantasy situation for enabling clients to imagine what they would do in particular situations. Confusion, the method to deal with confusion of the client is Tohi's reluctance in discussing about an unpleasant event. The hesitating attitude of the client can be shown via an avoidant attitude, unclear conversation, and vague fantasies. Patterson, 1986. 5.2.5 Applications. Gestalt therapy was originally used to treat anxious and depressed individuals and patients without chronic, acute diseases. Nowadays, this therapy is found to be extremely beneficial in treatment of personality disorders like borderline personality disorder. It also has been found to be beneficial in couples, counseling groups, and families. Corsini and Wedding, 2000. 6. Critical evaluation. Many of the humanistic concepts like the uniqueness of each individual, the importance of therapist's genuineness, the satisfying emotions which are achieved after the convergence of real and ideal self and from achieving one's highest potentials, the significance of the finding of the meaning of one's life, and the ability of a person to choose and be self-directed, have had major impact on our contemporary views of both human nature and the nature of good psychotherapy. Carson and Butcher, 2007. Humanistic therapies have been criticized for their lack of agreed-upon therapeutic procedures and their vagueness about what is supposed to happen between client and the therapist. Carson and Butcher, 2007. Controlled research on the outcomes achieved by humanistic therapies was lacking in past, but as the number of controlled outcome studies grows, there is evidence to suggest that these treatment approaches are helpful for patients with a variety of problems including depression, anxiety, trauma, and marital difficulties. Elliott et al. 2004. 7. Summary. Humanistic therapy focuses on the positive aspects including free will, freedom to find meaning in life and personal growth. Two kinds of humanistic therapies are Rogers client-centered therapy and Perls Gestalt therapy, both of which emphasizes its self-awareness and self-acceptance. Evidence has shown it beneficial for various psychological and interpersonal problems. Yoga is a physiological, psychological and spiritual activity which has the ultimate goal to unite mind, body and soul, along with a state of unity with the environment one is placed in. It is being practiced from over 400 years and nowadays is used by people to stay fit, both mentally and physically. Yoga can teach its followers to how to excite the internal organs and to pressurize the glandular areas of the body with the help of both meditation and breathing strategies, forcing you to change the way you feel, think and perceive. It is not just one exercise but a series of it. It is most commonly practiced by the educated that can be seen daily in parks or clubs as practicing bend stretch activities along with deep breaths. It does not matter that in which age period you lie, it is appropriate for children, adolescents, adults or even for the olds. Nowadays even physicians have understood its importance and some of them prescribe it along with medication for treatment and healing. Pregnant women use yoga as a method for prenatal care. Yoga has also been found useful for people with mental disorders like depression, anxiety, phobias, etc. Hence, one should not have any difficulty in accepting yoga as a global icon of peace and serenity. Meditation can be defined as an activity in which the mind is trained in a specific way and an alternate state of consciousness is tried to achieve. Some practitioners of meditation defined it as the deepest sleep when the mind becomes free from the negative emotions of hate, resentment and agitation and in turn is filled with the positive emotions of love, joy, serenity and a high spiritual experience. The traditional art of Raja Yoga was used by the Kriya Yoga developed by Paramhansa Yogananda in order to achieve the internal sacred experience of God. Thus both Raja and Kriya Yoga combine to form the core for the yoga meditation. In the today's fast-speeding world of stress and conflicts, meditation has gained popularity as a method to reduce stress and anxiety, be happy and peaceful. It may be practiced in various forms like either concentrating mind on an object or like Buddhists try to have a full awareness of the activity one is engaged in or using prayer beads mantras. 3. A brief look at the history. The yoga originally had its birth in India around 5,000 years ago. Its origin resides long time back at the time of Harappa civilization. Excavations have found seals which had images of yogis. Harappa and Mohenjo-daro were one of the most important cities of that time who were being credited for the formation of Hinduism, Jainism and Buddhism along with other Harappan cities. Most yoga writings are being found in the Sanskrit language and in fact yoga is related to Latin, German, French, Spanish and Greek. It can be observed by the word yoga corresponding to the Psychology paper number 15, Clinical Psychology module number 33 Yoga and Meditation. Words of such languages like yugam, yoke, zugos, jog and yugo. Vedic yoga is the kind being found in the texts of Vedas. Vedic yoga, also known as archaic yoga, was related to the ritual life of people of that time. The word, sacrifice, is at the core of the Vedic yoga, which helps people to connect the material world with the spiritual world. At the Rig Veda age, the Brahmins performing the rituals had to fix their mind fully for a large amount of time in order to perform it rightfully. This principle of the focus of the mind lies at the core of the modern day yoga. Around 200 AD the pre-classical yoga emerged with the texts of the Upanishads, who did talk about the unity of everything. The two pre-classical schools, Ramayana and Mahabharata, who urged to use various strategies aimed at performing a thorough and intense meditation in order to achieve the true meaning of one's life. Bhagavad Gita introduced Bhakti, Jnana and Karma Yoga. Then around 500 AD classical yoga was formed, which was versed at the Yoga Sutra of Patanjali. It is often called as Raja Yoga and has 8 different forms. It emphasized that every being is composed of a Purusha and Prakriti, yoga being the method to differentiate between these both and purify the Purusha or soul of the person. Post-classical yoga is comprised of a series of various schools that develop their own kind of techniques. Vedanta, which seeks the ultimate unity everything, developed on the basics of Upanishad. Alchemy lead to the development of Tantra Yoga with Hatha Yoga as one of its branch which focused on energizing one's body to an extent that its basic elements gets changed, prolonging one's life or even claim to make one immortal. Swami Vivekanand, Indra Devi, Swami Sivananda and many more yogis are being credited for the emergence and practice of yoga in the West. Despite of debates, many archaeologists agree to the view that meditation is just as ancient as yoga, and in fact it is a part of the yoga. In some wall paintings of the time of Harappan civilization humans had been found meditating. Some argue that meditation was a principal practice of the Rig Vedic people who meditate by focusing their concentration on the fire. In ancient texts of Ramayana and Mahabharata, principally sannyasi used this strategy in the form of tapasya in order to earn moksha, while it was been used by some to ask for a favor or boon from God. Around 500 BC Lord Buddha, see figure 1, introduced meditation as a method of salvation, which later on led to the development of Zen, Tibetan etc. In Islam from 8th to 12th century various forms of meditation emerged. Dikar involved recapitulation of 99 names of Lord. Sufism, controlling one's breath and recapitulating the sacred words, and Taa Fakir involved thinking and contemplating about the world. During this time Greeks practiced hesychasm, which involves recapitulation of the Jesus prayers. However, at around 6th century, in West, reading Bible was a form of meditation. Now from the 20th century meditation has been adopted, both in India and West, as a method of stress, anxiety reduction, method to relax and improve one's personal self. 4. Yoga, search for salvation. 4.1 Defining yoga. The word, yoga, emerged from the Sanskrit root yuj, which means, to join, or, to yoke. Thus it can be understood as a connection, unity, oneness, integration, accord, cohesion, or harmony, between one's body, mind and soul. The continued practice of yoga will lead one to a sense of peace and well-being, and also a feeling of being at one with his environment. Panini, a Sanskrit grammarian, proposed that the word yoga has 2 roots, yujir yoga which means combining and yuj samadha which means concentrating. Patanjali, who developed Yoga Sutras, claims the yuj samadha is the real meaning of the word yoga, while Bhagavad supports yujir yoga as the root of the word yoga. Yoga seeks to reduce the materialism which exerts pressure on. Psychology paper number 15, Clinical Psychology module number 33 Yoga and Meditation. The human soul, and to use the method of introspection in order to attain stillness in the fast-pacing world. Hence, practicing yoga can be explained as a continuum of unbreakable postures that purports to achieve the ultimate calmness, peacefulness and equilibrium of the spirit. Some have defined it as an internal protection from the worldly havoc and upheavals. Patanjali proposed that daily practicing yoga can even break those habits, thoughts and actions which represent corruption, negativity and materialism in a person. Broadly, it can be defined as a composite system of spiritual disciplines which are basic to Hinduism, Jainism and Buddhism that were formed early in Asia. 4.2 Yoga and its types. There are various types of yoga that are developed over time across the world. Some of them are discussed below. Hatha Yoga, one of the most popular type of yoga in the West, to deal with stress, anxiety and depression. It includes positions of body asanas, regulation of breath pranayama, and focusing of concentration dhyana. Bikram Yoga, the type which involves intense workout. It aims to increase one's persistence, muscle strength, pliability and to achieve an optimum weight. Ishta, integral science of Hatha and Tantric arts, which seeks to unblock energy channels via poses of the body, concentration and imagination. Integral Yoga, it involves poses of the body, control on one's breath, servicing selflessly, meditating, chanting, praying, and exploring self. Ashtanga Yoga, it is the type of yoga which requires high physical labor. Ashtanga Yoga requires one to control breath along with formation of a progressive, incessant chain of body postures. Jivamukti Yoga. Jivamukti Yoga is a type of yoga which affects the spirit of its practitioners, due to its emphasis on reading scriptures, praying and being nonviolent and vegetarian along with physical activity. Kripalu Yoga. It's a yoga type which emphasizes on being in a body posture for a while until it gets changed by itself. Thus it focuses on the consciousness of a person. Kundalini. Kundalini emphasizes on the arousing of the energy at the spine's base and gradually dissipates it to the other parts of the body. Restorative Yoga. It is the type of yoga used principally for relaxation of muscles. The person lies down on carpet, rug, pillow, block etc. for a long stretch of time in a passive manner. Lingar Yoga. The slower version of yoga which uses materials like pillows, carpet, belts etc. in order to make it comfortable for the injured, physically disabled or old-aged people. Psychology paper number 15. Clinical psychology module number 33. Yoga and meditation. 4.3 Scientific nature of yoga. Earlier yoga was considered as a part of religious or spiritual activity which helps one to achieve the unity of mind, body and soul and having oneness with the God and environment. But with increasing establishments it is being considered to be more scientific in nature. Science can be defined as something which is objective, universal with some exceptions, and involves a pre-planned series of methods or strategies. Yoga can be viewed as a science which seeks to help one to systematically explore his own self in a process of self-realization and creating a harmony between the spirit and the body. It involves systematic techniques of meditation, controlling of breathing pattern and a chain of series of bodily postures. The ultimate goal is to help the humans practicing it in one way or another, just same as that of science. 4.4 Exploring the true human nature through yoga. What yoga teaches us as a human being is to have a relation with our true nature. It states that our true nature is our highest potential which is endless and surpasses our minds. The word yoga literally means to unite or combine ourself with our true nature. This integration can only be done via following various yoga principles. Before this integration we are insecure, fearful, separate from ourself, doubtful and more or less incomplete. According to Samkhya the spirit can neither be created nor be destructed, it is never attached to anything, neither it is free, nor it wants salvation. The only relation that self has is from itself. Thus yoga helps a person to have an insight of this self, which is clear, endless, and infinite. According to the Patanjali there are 5 prerequisites which decide a person's psychological condition or siddhavritti, avidya or disregard, asmita or one's personal identity, raga or enthusiasm, dvesa or rage and abhinivasa or desire to be alive. These entire 5 states join together to form a psychological condition of a person, but they are as a rule responsible for all the sufferings of human. Thus human life is a suffering. It is the yoga which leads to the suspension of siddhavritti and thereby terminates the sufferings. Vasana, the preconscious sensation serves as an obstacle in the road to salvation by constantly feeding siddhavritti. The vasana is represented by the person's preconscious mind, which seeks to actualize itself via human behaviors in order to prove its existence. Yoga is thus a strategy to have a check on vasana and seeks to burn the 5 states of consciousness of a person in order to purify and liberate self. 5. Meditation, going till the infinity. 5.1 Defining meditation. Meditation can be defined as a method in which a person teaches his mind to enter into a specific state of consciousness. According to Roger J. Walsh and Dean H. Shapiro, meditation refers to the chain of strategies that involve a deliberate attempt to concentrate one's attention in a non-judgmental way so to achieve a stillness of mind and thoughts, and to avoid vague and deep forms of thinking. Thus defining the word meditation requires definition of 4 of its components. Firstly, meditation includes the purpose to concentrate on a specific object, state or whatever it requires. Secondly, meditation does not require to be necessarily be defined with reference to a religious activity. Psychology paper number 15, Clinical psychology module number 33 Yoga and meditation. Thus practicing meditation may involve continuously reiterating a specific word or paragraph, but with the aim to achieve oneness, peacefulness, and stillness, and not with the aim to please God, as in praying. Thirdly, it also includes a deliberate effort to control the mind from wandering here and there and to maintain a continuous focus on the practice. There are different instructions in order to face such a situation. Like, according to Benson, one should take no notice of the arising of alternative thoughts. Dakeman proposed to just eliminate such thoughts. Some Buddhists propose to put and press tightly the tongue between the teeth and grip, break and destroy the arising thought. Vipassana proposed to just note and identify it as your thinking, while Zen proposed to note, watch, get bored and let go the thought. Fourthly, it is not significant that what is the thought, it just may appear and disappear. What important is the conscious attention of the continuum of the appearing and disappearing of thoughts. Hence, initially meditation may have originated as a religious activity, but gradually it turned as a means of attaining calmness, tranquility, serenity, stillness, along with the aim to build an inner energy filled with warmth, kindness with a forgiving, generous and patient nature. 5.2 Meditation and its types. There are various types of meditational practices that have emerged over time. However, here we will only describe some of the basic ones. Transcendental meditation. It is a concentrative type of meditation which involves sitting rigid in a straight posture and repeatedly chanting a holy word, like Om. Main focus is to achieve stillness, along with the control and manipulation of the breathing process. The distraction by the alternative thoughts is prevented by actively first noticing the thought and then returning back to the practice. Transcendental meditation may lead to a feeling of the exclusion of the spirit from the physical body, which ultimately leads to the construction of a new form of energy. Its origins lie in the Vedanta school of meditation, of Hinduism. Vipassana meditation, also known as mindfulness form of meditation, which has its origins lying in the Buddhism. It involves getting aware of each and every thought that appears in the consciousness with being detached and non-judgmental. It is preferably a process of observation of the breathing process, present senses, emotions, sounds or images, the practice being implicated in the routine activities like eating, working, drinking, etc. It can be termed as a form of low energy. Vipassana meditation is one of the most famous forms of meditation. Zazen meditation, it is one of the most difficult forms of meditation, having its origin in Buddhism. It involves sitting in a straight posture and paying minimal or least attention to any activity. It starts with focusing one's attention to an immediate underlying thought, turning it then to another level consciousness, the preconscious mind. Requiring higher concentration, it is thereby directed to the final level of consciousness, i.e. the unconscious mind. Some have argued that the unconscious is not the final level, but the concentration reaches to another level of pure consciousness. The ultimate aim of Zazen is to combine and to achieve oneness in all levels of consciousness. Kundalini meditation is a branch of meditation that has its origins lying in the Vedanta school of meditation. It focuses on the flow of energy from the bottom of the spine towards the head, passing via the various energy centers of the body. The breathing process is controlled in order to produce a continuum of energy and to take it to the Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. Infinity. However, a major drawback of this type is that if practiced inappropriately, it may lead to a psychological disorder named Kundalini syndrome. Qigong meditation. It is a form of meditation which was first encouraged in Taoism. The energy is rotated in the body via the various energy centers and organ systems, in a circle called the microcosmic orbit, principally by the process of controlling and manipulating one's breathing processes. The awareness is concentrated on 3 parts of the body: navel, chest and head. 6. Yoga and meditation. Lifetime insurance policies with unlimited benefits. So what are the benefits of yoga and meditation? Does one should practice them just to have a view of our own secret spirit? Or one should accept yoga meditation as a means to achieve oneness with the world? Or one should perform it just because it is a new trend in fashion? Let's have a view of the various benefits of yoga and meditation. See Table 1 and Table 2. Table 1. Psychological benefits of yoga and meditation. Psychological benefits. Improvement in concentration, improvement in retention and retrieval of memory, improvement in focusing of attention, improvement of learning abilities, stability and mood, increase in one's sense of positive well-being, increase in somatic and kinesthetic awareness, growth in self-realization, growth in self-actualizing tendency, boosting one's social abilities, decline in depressive symptoms, increased control on anxiety level, decline in hostile behavior, harmonizes mind, body and soul, improvement in depth perception, improvement in stability, improvement in neurons activity inside brain, boost in cognitive abilities, increased tolerant and forgiving behaviors, growth of compassionate nature, increased self-acceptance, expands wisdom, improvement in levels of happiness and force a peaceful, calm and serene attitude towards others and towards life. May emphasize religious beliefs in relation with God. Increased motivation and goal-directed behavior. Increased inner spiritual energy, improvement in flexibility and openness to ideas and new experiences, unity of consciousness, reduced drug, alcohol abuse helps in dealing with certain kinds of phobias, increased creativity and fearlessness. Consciousness, reduced drug, alcohol abuse helps in dealing with certain kinds of phobias, increased creativity and fearlessness. Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. Table 2, Physiological benefits of yoga and meditation. Physiological benefits. Provide a good sleep to insomniacs, higher functioning of immune system, reduction in body pain, lead to a straight posture, normalizes one's weight, growth of body flexibility, boosts one's energy, growth in muscle power, growth of stamina, regulates the process of excretion, normalizes heart rate, increased endocrine organs functioning, increased efficiency of respiratory system, lead to a good digestive system, keeps a check on blood pressure, stability in nerves processes, increased heart strength, improvement in galvanic skin responses, increased lungs capacity, regulate alpha waves of the brain, growth in respiratory amplitude, increased freshness in the body, increased hair growth, improved joint movement, rise of the strength of the grip, improvement in eye-hand coordination, improved adroitness, increased reaction time. 7. Yoga and meditation, having their dark faces. Every coin has 2 sides. Yoga and meditation are also not have been spared by their critics. Their adverse effects can be both physical and psychological. Most of the supporters argue that these problems arise only if yoga meditation is performed inappropriately or out of the recommended sequence. Others propose that when these activities performed without any religious context or without the appropriate supervision can lead to dysfunctional problems. Moreover, performing them more than the required amount, i.e. overpractice, may lead to adversity. Some others suggest that it is a certain class of population which may lead to disadvantage rather than the advantage with these practices, like people with certain mental problems, schizophrenia, depression, physical injuries, either old age or children under the age of 15, cardiovascular problems or respiratory problems. Thus it will be a specific type of yoga meditation that may benefit these while other will not. Being overambitious, competitive and going beyond one's limits can also cause problems. Physical adverse effects may include bones fractures, spinal problems, head and knee injuries, gastrointestinal problems, abdominal pain, muscles and joint pains, internal bleeding, headache, physical exhaustion, respiratory problems, eye injuries or dysfunctional hearing, tissue breaks, difficulties with sexual organs, complete loss of essential nutrients and water, complications in pregnancy, or even may end one to problems with cardiovascular system or cardiac arrest. Due to the several researches suggesting the possible disadvantages of yoga, American Yoga Association does not suggest yoga to be allowed for kids under the age of 16. Practicing it may hamper the physical, glandular and/or nervous development of their body. Results of some studies also. Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. Indicate that improper practice of meditation may lead to abrupt increase or decrease in blood pressure or breath rate and even to chronic pain in some parts of the body. Inverted postures of yoga like Padahastasana are associated with head injuries, headaches, temporary blindness, back pain, spinal problems or even a nervous breakdown. Bikram yoga and Ashtanga yoga, which involves intense physical labor, may result in burnout, fractures or a crack in tissue or muscles. Since they along with pranayama involve holding of breath, they should not be performed in case of infectious diseases. Hatha yoga poses, if not performed in perfect series, may lead to gastrointestinal problems, while improper practice of Kundalini yoga may result in muscle cramps. Some yoga practices may involve one to vomit daily before the practice, which can adversely affect the teeth of a person that may get eroded. Postures in yoga which requires one to bend forward may lead to the chronic pain in spine and back. Overstraining of the less flexible joints may end one to bed for several months of healing, while the application of undue force on the abdomen may also result in its inflammation. Yoshikawa proposed 7 factors to consider while performing yoga postures that requires one to get upside down, Sarvangasana or Sirsasana. Uneasiness. Uneasiness may indicate overstraining on head area, which should be avoided by slowly returning back to the normal position. Spinal spondylosis. Any undue pressure on the vertebral column should be avoided in order to avoid injury. Heart problems and blood pressure. Inversion directs high blood pressure towards head, so overpracticing should be avoided. People with cardiovascular disorders should also take preliminary precautions and expert supervision. Diabetes. People with diabetes always have some amount of heart problems, which requires them to look for precautionary measures. Abopsia. Without prior practice, a sudden inversion may lead to the bursting of retinal veins of the eyes. Sinus ear infections. A precautionary measure for people with infections or inflammations in the head region. Pregnancy. Being upright down can result in complications in pregnancy, particularly after the first 3 years of pregnancy. Overpracticing or inappropriate performance of yoga and meditation may lead to imbalance in one's mental state in the form of psychosis, vagueness, fear, nervous breakdown, depressive symptoms, self-harming tendencies, reduction in self-esteem and self-confidence, spiritual disturbances, sleeplessness, decreased social skills, splitting of personality, tendencies to hallucinate, mania, tendency to suicide, violent behaviors and agitation. Inappropriate practice of Kundalini yoga may result in Kundalini syndrome, which is a type of psychological disorder. Other adverse effects of Kundalini yoga may involve a constant feeling of movement of heat in the spine, sensations in the head, vibrations in the back, pain in internal organs of the body, irritation inside the skin and unusually high sexual excitement. Hatha yoga and Kundalini yoga if performed out of their sequence may end one to autistic disorder, which can be referred to as a reduction in Psychology paper number 15, Clinical Psychology module number 33 Yoga and Meditation. Socio-emotional abilities, and disturbances in one's unity with the spirit. For schizophrenics or drug abusers meditational practices are advised to be operated with precaution. Some studies have revealed that a person's body should be well prepared via yogasanas first in order to gain benefits from some kinds of pranayamas like Kapalbhati and Bhastrika. Otherwise it may lead to the production of intense internal energy which ultimately can end up one to the problems in concentration, rapid shifting from one thought to the another, agitation, acute mental trauma and even to the destruction of one's nervous system. Too long holding of postures may also lead to both psychological and physical tensions. Some practitioners of yoga meditation had also reported that they had experienced paranormal activity in their life. While inappropriate practicing may also lead to one's death, a caution need to be taken during the practicing of meditation by people with severe mental disorders. In mentally disordered patients, meditation may elicit certain feelings, thoughts, images, temporary vagueness and depersonalization that may add up to their mental imbalance. A study by the psychologist Otis revealed that longer the practitioner meditate, more is he likely to experience vagueness, sadness, unacceptability, boredom and reduction in social activities. Moreover, meditation has not been found to be effective in cases of constant continuous depression and migraine headache. Meditating for a large span of time and allowing the passage of thoughts without their analyses may lead to maladjustment in one's behavior, impairment in attributional abilities and loss of awareness of the reality. Some researchers found their participants reporting an addiction to the transcendental meditation, i.e. on terminating the daily practice of transcendental meditation they started experiencing feelings of hopelessness and worseness. The researchers had formulated a hypothesis to define the reason for the experience of negative effects during meditation, especially the transcendental meditation. They propose that the experience of negative effects may arise due to two factors. First is physical by nature, related to the sitting posture. The rigid straight pose of sitting may lead unconsciously to a feeling of insecurity as if the person falls asleep during the meditation process he may fall leading to head injury. This apprehension may result in feelings of anxiety and fear every time the person sits for the practice, leading him to aversely conditioning these feelings with the sitting position. The second factor is mental by nature, which indicates the suppressed feelings and thoughts of the mind. Especially, when the person slides between sleep and meditation, these alternative thoughts tends to lead the individual from a lower state of relaxation to a higher state of arousal, thereby disturbing the practice. If the individual deliberately ignores the thought via the process of self-regulation to return back to the lower level of relaxation or light sleep, he will be emotionally balanced. But if he fails to do so, it may end up in feelings of anxiety, loss of control and emotional maladjustment. Despite of a number of adverse effects produced by meditation and yoga, they are being largely emphasized by many of their practitioners and supporters, possibly because their merits outnumber their demerits and because the mental peace and oneness they provide us with in today's fast-pacing technological world. 8. Principles of yoga and meditation applied to psychotherapy. Psychotherapy refers to the assisting the patient to deal with his maladjustment, behavioral and mental problems via the psychological professionals, clinical psychologists, psychiatrists, with the goal to change the patient's problematic emotion, idea, beliefs and/or responses. Here we will explain the use of meditation and yoga in the psychotherapeutic techniques, which are largely studied by the field yoga psychology. Psychology paper number 15, Clinical Psychology module number 33 Yoga and Meditation. 8.1 Yoga Psychotherapy, what is it? The origins of yoga psychotherapy lies in Vedanta, a school of monistic Indian philosophy which emphasizes on the point that every person has a pure consciousness and it is this consciousness which never changes in a person, as opposed to our feelings, ideas, values and physical body that do continually fluctuate with time. It claims that if experiences of a person present in his conscious awareness teaches him something valuable, then not only he can successfully manage his life events, may then fully experience the positive emotions of joy, faith, hope and love. Personality is not just a bunch of habits or behaviors, rather it refers to the experiencing of these limited and constantly evolving factors. It is just a context in which our consciousness and inner energy floats. Yoga psychotherapy thus not only seeks to enhance a person at his personality level, rather it seeks to do it at a very higher level of acceptance of ourself and the reality, happiness and peace. It seeks to provide the person with a sense of personal freedom to choose the way he wants to live in order to have self-attainment. It teaches one to accept the reality of himself and of his environment, and maintain balance with it in order to grow, evolve, to achieve goals, values and stability of emotions, liberate inner energy and potentials for action. 8.2 Principles of Yoga Psychotherapy. There are certain principles on which the entire therapeutic technique of yoga psychotherapy are based. They are: 1. Yoga psychotherapy is empirical by nature, i.e. it initially deal with only certain issues and problems of the client that ended him to psychotherapy, however later on it may take a more philosophical and intellectual view. The ultimate aim is to end the client's problems. 2. Yoga psychotherapy not only aims to reduce the hardships of the person but also to induce in him such powerful positive emotions of love, hope, joy, innovation and faith. 3. Yoga psychotherapy is an approach of the whole, i.e. it seeks to merge the cognitions, behaviors, emotions, experiences, physiology, and interpersonal and spiritual aspects of the person. 4. By operation, yoga psychotherapy is experiential and experimental, i.e. clients are motivated by the yoga psychotherapist to themselves assess the beliefs, strategies and theories of the yoga psychotherapy in terms of their validity and efficiency, rather than just accepting them with closed eyes or just because being forced by the therapist to do so. Here there are two aims: first, to provide the client with the freedom of personal choice and right to decide. Secondly, the methods of experiments applied help the psychotherapist to decide the type of method and conditions best suited for the client. 5. Yoga psychotherapy has a spiritual essence in the sense that it provides its clients with the ideas and methods which can be used by him over his entire life for self-attainment and growth. It does not do a temporary job, rather it gives the client the required abilities to continuously fly high to the divinity and an everlasting harmony and acceptance of reality. Perhaps yoga psychotherapy is the only kind of psychotherapy which focuses on the client's spirit. It provides its clients with the polar attitudes and emotions like good or bad, anger or peace, hate or love, etc. That helps the clients in the process of acceptance and self-actualization. 6. Yoga psychotherapy is culture-free, i.e. its techniques and beliefs can be applied to people of almost any culture or religion, no matter whether they are followers of Hinduism, Buddhism, Jainism, Sufism, or any other. Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. 8.3 Meditation and other techniques used in yoga psychotherapy. There are various attitudes and techniques of yoga which are applied in yoga psychotherapy, meditation being one of them. Others are Vairagya, self-acceptance, mindfulness, pranayama and viveka. 8.3.1 Vairagya. Vairagya is one of the most effective and basic tools used in yoga psychotherapy, on which various other tools may also depend. It teaches one to be emotionally detached, i.e. neither like nor dislike anything whether it comes from inside feelings, perceptions, ideas, beliefs or from outside environment. It leads to the ultimate freedom and a sense of freedom. According to some Neo-Freudians, a person's response to another person, idea or object may take three forms: attraction, moving towards, aversion, moving away, and both aversion and attraction oppose them. Yoga psychotherapy offered a fourth way, Vairagya, i.e., simply be with such stimuli, just coexist with them so that a minimal amount of focus is paid to them. Vairagya helps the person in the process of acceptance, openly accepting and appreciating the realities of his life in their pure and fullest form, no matter how many hindrances are there. Application of the tool of Vairagya in clinical practices specifically involves the treatment of anxiety disorders. For example, in treatment of panic disorders, Vairagya suggests one to clearly accept his undesirable idea without escaping from it or thinking it is something worse. In treatment of obsessive-compulsive disorder, OCD, the therapist in a series of methods makes the client to face the stimuli of ascending intensity along with suggesting him to try acceptance of the concurrently emerging undesirable sensations. Due to a repeated practice of this approach of accepting attitude, the client gradually becomes tolerant, immune to the stimuli. 8.3.2 Meditation. Meditation, as described earlier, has an ample amount of mental, spiritual and physical benefits to reason with oneself to practice it daily. It helps one with increase in self-regulation and to achieve self-actualization and harmony in one's life. Meditation is a technique to learn to focus attention on an object or on a mantra in order to have an insight into the various levels of mind, to achieve peace, integration with one's environment, and mental growth. In clinical practices, meditation has been found to counterattack on depressive thoughts, anxiety and stress. Almost every client undergoing yoga psychotherapy is advised to daily practice meditation primarily due to four reasons. Firstly, it induces a sense of relaxation, calmness and peacefulness for both mind and body. Secondly, it leads its practitioners to an increased sense of self-awareness that ultimately helps them to deeply investigate their own mental processes and problems and find an appropriate solution for them. Thirdly, meditation helps its practitioners with an increased alertness of the various events of their surrounding world, thus helping them to deal with such daily events on their own, with increased efficiency. Fourthly, meditation is related to the attainment of Vairagya. With still posture, controlling of the breathing process, focusing on a specific object or mantra, the client acquires the skill to get aware of a thought, view it in a non-judgmental manner, accept and letting it go results in the emotional detachment aspect of Vairagya. Various researchers have found a positive correlation between the time span of practice of meditation and the level of happiness and mental well-being. Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. 8.3.3 Self-acceptance. Unconditionally accepting oneself is an important tool of yoga psychotherapy which has replaced an earlier conditional tool of self-esteem related to the level of convergence of the real and ideal self. Here clients are suggested to exclude the middleman, i.e. various norms and specifications, and accept themselves as they are with all of the demerits or failures they may have. Loving, respecting and caring oneself unconditionally leads to a happy and prosperous life, while disliking, hating, disrespecting and even abusing ourselves more than often leads to a disturbed mental and physical health. According to yoga psychotherapy, recurrently abusing and blaming our own self may result in a terrible habit of disliking ourselves even if we have now beaten our every faulty thought or behavior, that ultimately ends one to psychological and adjustment problems. 8.3.4 Mindfulness. Mindfulness involves a deliberate effort aimed to fully concentrate on the present reality. Yoga psychotherapy trains its client to be aware of the inner and outer experiences without conjecturing or using their high cognitive abilities. These inner experiences may include one's feeling, idea, or physiological sensation, while the outer experiences may include one's responses, sensory observations, etc. By increasing his consciousness towards these inner and outer experiences, the client becomes sensitive for the complicated relation existing between these experiences, thus allowing him to analyze, interpret and change the distress-producing thoughts, emotions and behaviors. Mindfulness thus seeks to increase the self-control and self-regulatory habits of the client, providing him with greater adjustment, happiness and well-being. Practicing mindfulness ultimately helps the client to increase self-acceptance and Vairagya. 8.3.5 Viveka. Discrimination. People with problems in their lifestyle tend to have acceptance of wrong and negative thoughts and feelings as a result of inability to select the positive alternatives. Yoga psychotherapy provides its clients with the tools to first let flow the thoughts in the conscious of the client and then to analyze them in terms of their appropriateness, validity and accuracy. Thus yoga psychotherapy seeks to develop body of the client, which provides the client with the ability to discriminate, which in turn helps him to go deeper into a vidya, wrong perception, and change it wherever necessary. For example, if the client has a feeling or thought of one of his past behaviors is worse than his viveka may enforce him to look about the possible mistake of the stimuli or the external environment. Clients should be helped to get free from the delusion of inappropriately analyzed conclusions. Sri Shankaracharya proposed that the maintenance of a delusion leads to the perception of rope as a snake, while ending it leads to the end of the false perception. Viveka in yoga psychotherapy seeks to develop pure infinite Satchidananda, knowledge, existence, happiness, and to make them aware of and change their inappropriate beliefs of being limited, hindered and changeable. Hence via the tool of Viveka, yoga psychotherapy practically helps the client in making a lifetime unity with their infinite spirit and in achieving enlightenment. 8.3.6 Pranayama. Respiring or breathing is the most important function of the human body. Yoga psychology has enforced on the power of breath regulation via breathing exercises and regulation of the nervous system, ultimately leading the person to a peaceful and healthy body both physically and mentally. Researchers have shown that the breathing pattern of a person represents his state of mind. Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. Anxiety leads to rapid, small and shallow breaths. Depression leads to slow and non-continuous breaths. While feeling of peacefulness and oneness leads one to the unhindered, smooth and easy breathing. Thus yoga psychotherapy via pranayama seeks to change the physical condition of its clients and thus changing their mental state of distress. For example, for clients with panic disorder, the yoga psychotherapist suggests him diaphragmatic breathing, i.e. easy breathing via nose, where the processes of inhaling and exhaling are more or less same interlinked without any breakage, which in turn relaxes the autonomic nervous system and prevents overventilation of air that is responsible for the panic attack. To deal with depression, yoga psychotherapist advises its client to try Kapalabhati, in which breath is rapidly and forcefully inhaled and exhaled via nose, followed by natural, slow and calm breaths. Yoga psychotherapy also uses other types of pranayama to help its clients deal with insomnia and or other mental disorders. Since some of the research suggests the adverse effects of pranayama, it should therefore not be practiced without the proper supervision of professionals, and overpractice should be avoided. 9. Summary. Yoga is a physiological, psychological and spiritual activity which has the ultimate goal to unite mind, body and soul, along with a state of unity with the environment one is placed in. While meditation can be defined as a method in which a person teaches his mind to enter into a specific state of consciousness. The origin of yoga and meditation resides long time back at the time of Harappa civilization. At the Rig Veda age, the Brahmins performing the rituals had to fix their mind fully for a large amount of time in order to perform it rightfully. This principle of the focus of the mind lies at the core of the modern-day yoga and meditation. Swami Vivekanand, Indra Devi, Swami Sivananda and many more yogis are being credited for the emergence and practice of yoga in the West. Now from the 20th century, meditation has been adopted, both in India and West, as a method of stress anxiety reduction, method to relax and improve one's personal self. There are various types of yoga: Hatha yoga, Bikram yoga, Ashtanga yoga, Kundalini, Lingara yoga, etc. Earlier yoga was considered as a part of religious or spiritual activity which helps one to achieve the unity of mind, body and soul and having oneness with the God and environment. But with increasing establishments it is being considered to be more scientific in nature. According to Samkhya, the spirit can neither be created nor be destructed, it is never attached to anything, neither it is free, nor it wants salvation. The only relation that self has is from itself. Thus yoga helps a person to have an insight of this self, which is clear, endless, and infinite. There are various types of meditational practices: transcendental meditation, Vipassana meditation, Zazen meditation, Kundalini meditation, and Qigong meditation. There are various benefits of yoga and meditation: stability in mood, improvement in levels of happiness, increased self-acceptance, harmonizes mind, body and soul, growth in self-actualizing tendency, reduction in body pain, improved reaction time, growth in muscle power, higher functioning of immune system and many more. Their adverse effects can be both physical and psychological. Most of the supporters argue that these problems arise only if yoga meditation is performed inappropriately or out of the recommended sequence. Adverse effects may include bones fractures, spinal problems, physical exhaustion or imbalance in one's mental state in the form of Psychology paper number 15, Clinical Psychology module number 33, Yoga and Meditation. Psychosis, vagueness, fear, nervous breakdown, depressive symptoms, self-harming tendencies, etc. Yoga psychotherapy not only seeks to enhance a person at his personality level, rather it seeks to do it at a very higher level of acceptance of ourself and the reality, happiness and peace. It seeks to provide the person with a sense of personal freedom to choose the way he wants to live in order to have self-attainment.